You survived COVID. Great. What if I told you the new COVID subvariant XBB.1.16 isn't just targeting your lungs, but maybe leaving behind inflammation in your urinary system too? Now you're taking long, hot baths every night because TikTok said it helps sweat out the virus right. And what if I told you those long, steamy soaks might be silently hurting your kidneys, not helping them recover? Sounds wild, maybe. But this episode is packed with science patient stories and urgent warnings from doctors around the world that you need to hear now, especially if you've been using hot baths as your go-to post-COVID detox. Because your body doesn't need more heat. It needs help hydration and a little more awareness. When COVID-19 first shook the world, the focus was squarely on respiratory symptoms, coughing, shortness of breath, and fever. But as the virus mutated, something began to change. Emerging variants started showing different footprints. One such footprint may be quietly imprinting itself in the human urinary system, and the suspect is none other than XBB.1.16. Dr. Emily Stanton, a virologist at Johns Hopkins University, once said in an interview, "The most dangerous pathogens are not the ones that scream. They're the ones that whisper." The incubation period for this Omicron subvariant typically ranges between 2 to 5 days, sometimes up to 7. But here's the twist: many people never show classic symptoms like fever or cough. Instead, they might feel a vague sense of fatigue, slight brain fog, increased urination at night, a strange burning in the pelvic region that goes unnoticed, or absolutely nothing at all. This subvariant has drawn attention not for its ferocity in the lungs, but for its stealth in other systems. While most infected individuals report only mild cold-like symptoms or no symptoms at all, some recent medical reports and case studies hint at a curious correlation. Now, let's talk about the prodromal stage, that strange gray area between infection and symptoms. In traditional COVID, this meant mild sore throat or sniffles. But XBB.1.16 has a new blueprint. Emerging urinary symptoms: increased urgency to urinate, pelvic pressure or warmth, mild incontinence in people over 50, fatigue with no clear reason, foamy urine, a subtle sign of protein leakage from damaged kidney filters, lower back discomfort, kidney zone, and even early signs of kidney inflammation. So what's happening behind the scenes? Is it just coincidence, or is there a deeper biological mechanism at play? To understand this, we must first understand what makes XBB.1.16 unique. This variant is a recombinant born from the merging of two Omicron sublineages. It's engineered by nature for high transmissibility and immune evasion. But what's more intriguing is the genetic drift in its spike protein mutations that allow the virus to potentially bind not just to ACE2 receptors in the lungs, but in other tissues too. Here's where it gets concerning. ACE2 receptors are not exclusive to the respiratory tract. They're widely expressed in the kidneys, bladder, and the lining of the urinary tract. The virus's ability to latch onto these sites gives it a doorway into our renal and urinary systems. Once inside, the immune system's response can lead to inflammation, damage, and long-term dysfunction. Recent histological studies conducted on lab models and autopsies of COVID patients have revealed signs of viral particles in renal tissues. Researchers have noticed fibrosis, tubular necrosis, and even glomerular damage in some cases. While this was first observed during the alpha and delta waves, current reports suggest that XBB.1.16 might be capable of the same, if not more insidious impact, especially in individuals with pre-existing kidney conditions or compromised immunity. Let's talk about symptoms. Several patients recovering from XBB.1.16 infections have reported issues that were previously rare. Increased urinary frequency, lower abdominal pain, and unusual fatigue were among them. Urologists are now investigating if these symptoms are a direct aftermath of the infection or a result of an immune overreaction, commonly known as a cytokine storm, localized in the urinary tract. Even more worrisome are the pediatric cases. Children who generally showed resilience to early COVID variants are presenting with urinary tract inflammation weeks after infection. Pediatric nephrologists have raised concerns about a possible post-viral nephritis where the virus doesn't directly attack but leaves behind a trail of inflammation through immune-mediated damage. It's important to note that correlation doesn't always mean causation. However, the consistency and frequency of these cases are too prominent to ignore. Let's move deeper. What exactly does COVID-19 do to the kidney? Studies published in journals like Nature Reviews Nephrology and The Lancet have documented SARS-CoV-2's ability to directly infect kidney tubules. This leads to reduced filtration capacity, protein leakage into the urine, and in severe cases, acute kidney injury. The newer variants might not attack as aggressively, but subtle chronic impacts could still disrupt kidney health over time. Now, here's a twist. Could it be that the body, in its attempt to clear the virus, ends up damaging its own urinary system? That's a theory gaining traction. In autoimmune-prone individuals, COVID-19 might act as a trigger activating T cells that mistake kidney cells for viral invaders. This mechanism, known as molecular mimicry, has already been observed in heart tissues and pancreatic cells. Now, kidneys might be the next battlefield. What does this mean for the average person? First, awareness is key. If you've had COVID-19, especially the XBB.1.16 variant, and you're experiencing unexplained urinary symptoms, consult your doctor. Don't dismiss it as a minor infection. Second, maintaining hydration, avoiding nephrotoxic drugs, and monitoring renal function through simple blood and urine tests could prevent complications. Anti-inflammatory diet foods that fight silent inflammation. Berries, olive oil, fatty fish, salmon, sardines, leafy greens, turmeric, but not in excess. Let's talk about the long-term risk. Some nephrologists are concerned that the ongoing waves of COVID-19, even if mild, may quietly be increasing the burden of chronic kidney disease (CKD) worldwide. If the virus continues to touch renal tissues, especially in the vulnerable and elderly, we might be facing a post-pandemic crisis of organ health. Dr. Alice Renard, Harvard Medical School, shared COVID-19 is not done with us. It's simply getting more subtle. If we focus only on cough and fever, we're ignoring a rising wave of renal dysfunction. Professor Mark Delling, Oxford University, shared, "We are seeing a shadow pandemic, not of infections, but of organ scars left behind." Dr. Nina Patel, WHO Renal Task Force, shared, "Prevention is lifestyle, testing is vigilance, and awareness is survival. Kidneys don't complain loudly. By the time they do, it's often late. But there's hope. Thanks to increased research funding and global collaboration, scientists are now conducting focused trials to test anti-inflammatory treatments that protect kidney and urinary health post-COVID. From cytokine blockers to targeted steroids, low-dose corticosteroids, ACE inhibitors to protect kidney filtration barriers, antioxidants like N-acetylcysteine, NAC, the medical world is gearing up for this new phase, and you, the viewer, are part of this awareness movement. By watching, learning, and sharing, you're helping shed light on a hidden threat that could affect millions if ignored. Knowledge isn't just power, it's protection. Since early 2020, Google searches for post-COVID detox bath surged worldwide. TikTokers began promoting steamy recovery rituals from hot ginger baths to Himalayan salt soaks with eucalyptus oil. On the surface, it sounds lovely, but here's where it turns real. According to CDC data from 2024, over 36% of young adults who had COVID-19 reported starting a hot bath routine at least 3 times a week post-recovery. Among these, 14% experienced unexplained fatigue, dizziness, and urination issues within 2 months. Let's zoom in on why that matters. Doctors and nephrologists are sounding the alarm, and it's not a metaphorical one. According to Dr. Johann Myers, a practicing urologist and renal health expert, prolonged hot water exposure, especially in enclosed spaces with poor ventilation, can alter your electrolyte balance, increase fluid loss through sweat, and indirectly stress your kidneys. For those recovering from viral infections like COVID-19, the effect might be more pronounced. But how? Let's dive into the science of hot bathing and kidney health, especially in post-viral conditions. When you immerse yourself in hot water, your body temperature rises. In response, your body activates sweating to cool down. This leads to fluid loss, but not just water. You also lose critical electrolytes like sodium, potassium, and magnesium. These are the very elements your kidneys are responsible for regulating. Taking a hot bath triggers your body to increase heart rate, open up blood vessels, vasodilation, initiate sweating, release heat via the skin. This might feel therapeutic, but what's often ignored is the electrolyte loss that comes with prolonged exposure. When you're sweating heavily in a bath, you lose water, you lose sodium, Na+, you lose potassium, K+, you lose magnesium, Mg2+. Your kidneys are the cleanup crew. They regulate these minerals. If they're already stressed or recovering from COVID-related inflammation, they struggle to maintain fluid electrolyte balance, which is essential for everything from brain function to muscle contraction. Here's a close look at the chain reaction. 1. Hot water, excessive sweating. 2. Sweating, fluid plus electrolyte loss. 3. Dehydration, decreased kidney filtration rate. 4. Electrolyte imbalance, kidney stress or injury. That's where things go downhill. Now let's look at COVID-19 survivors. Even after symptoms subside, the kidneys might remain vulnerable. The virus is known to attack ACE2 receptors, which are present in kidney tissue. This means even a mild case of COVID can leave the renal system slightly inflamed or functionally impaired for weeks, sometimes longer. Proteinuria protein in urine, reduced filtration efficiency. For someone who had even a mild infection, this sets the stage for temporary or lasting kidney vulnerability. In this sensitive recovery phase, when kidneys are already working harder to return to homeostasis, forcing the body into dehydration through excessive hot bathing can be a dangerous double blow. So, no, the bath itself isn't evil, but the duration, temperature, and frequency matter more than you think. Case study. Example. A 28-year-old man in Tokyo post-COVID started a routine of soaking in steaming hot water for 40 minutes every night to clear out toxins. Within 2 weeks, he began experiencing fatigue, dry mouth, and reduced urine output. A visit to the doctor revealed signs of early-stage acute kidney stress triggered by electrolyte imbalance and dehydration. He didn't feel sick until his kidneys started to fail silently. This is not an isolated case. Health centers in South Korea, Italy, and Brazil have seen similar post-COVID hydration imbalances linked to excessive heat exposure. Some have also reported muscle cramps, palpitations, and brain fog, all signs of electrolyte imbalance often misattributed to COVID brain or general weakness. Here's the biological truth. Your kidneys filter nearly 50 gallons of blood per day, removing waste and balancing electrolytes. After a viral infection, they are hypersensitive to any fluid loss or imbalance. Hot baths, especially without rehydration, mimic the stress levels seen during fevers. And yet, despite mounting evidence, many still associate hot water with healing. It's a deep-rooted cultural belief, especially in Eastern traditions. We're not here to dismantle tradition, but to inform choices with science. So, what should you do instead? Expert recommendations. 1. Limit hot baths to 10–15 minutes at a moderate temperature below 40 drasti or 100 Kelvin. 2. Hydrate with electrolyte-rich fluids before and after bathing. Coconut water. ORS solutions, or simply water with a pinch of salt, can help. 3. Avoid bathing immediately after intense exercise or sauna use when your body is already low on fluids. 4. If you're experiencing dizziness, fatigue, or reduced urine output, seek medical advice, especially if recently recovered from COVID. 5. For true detox, consider nutrition and breathing exercises instead of extreme heat exposure. Dr. Anand Kara, renal specialist, New York Presbyterian Hospital, shared, post-COVID kidneys are like bruised apples. They look okay but are structurally weaker. Be cautious with dehydration. Professor Helen Lin, Harvard School of Public Health, shared frequent hot baths are not a problem. Frequent dehydrating, non-replenished hot baths. That's the issue. Dr. Michael Reeves, nephrologist, UCLA, shared, we're not against comfort rituals, but science must shape the limits. If you're dizzy, tired, or peeing less, your kidneys are telling you something. Let's talk about the emotional angle. Post-COVID, people are not just healing physically, they're emotionally scarred. They want comfort. They seek routines that feel safe, calming, and cleansing. A hot bath is one of the most universal symbols of relief, but comfort should not come at the cost of caution. Mental relief should be coupled with physiological understanding. That's why spreading this message matters. It's not just about kidneys. It's about respecting your body in the delicate phase of post-viral recovery. Understanding that healing is not only about doing more, but sometimes about doing things more mindfully. Remember, your body isn't a machine that resets overnight. It's a living system communicating in signals. Fatigue, dry skin, changes in urine color. These are whispers from your kidneys. Listen before they start to scream. Common myths busted. Sweating detoxifies the body. Not exactly. Your liver and kidneys do the real detox work. Sweat helps regulate temperature, not clean your blood. If you drink enough water, long baths are safe. Not if you're not replacing lost electrolytes too. Water without salt can actually dilute your sodium levels, further risking hyponatremia. Feeling relaxed means it's healthy. Hot water relaxes muscles and nerves, but that doesn't mean it supports long-term organ function. So next time someone tells you a 45-minute bath is their secret to post-COVID cleansing, ask them, have you checked in with your kidneys lately? Because that's what this is really about. Long-term health, deep awareness, mindful recovery. Here's the truth. No one puts in a viral reel. Healing isn't about intensity, it's about intelligence. If you've had COVID, especially the XBB.1.16 strain, and you're feeling off in ways that don't make sense, your kidneys may be whispering for help. Don't wait for them to scream. Keep your baths short, your water salty in the right way, and your recovery informed, not influenced. Share this video with someone who thinks they're just sweating it out, because what they're actually doing might be draining more than toxins. At Sit Here with Teenagers, we're not here to sell you trends. We're here to tell you the truth even when it's quiet, complicated, or uncomfortable. Your kidneys don't have a voice, but after today, you do. So speak up, hydrate smarter, and let your healing be as strong and as silent as the organs keeping you alive.